Welcome to HIV AIDS and First Aid for Addiction Counselors. My name is Desiree Cochran Norfolk. I am an addiction counselor. I hold a master's in addiction counseling, and I'm certified by the Georgia Addiction Counselors Association as a certified clinical supervisor, certified master addiction counselor, and a CAC2. I'm also certified as an anger management specialist and family violence intervention program facilitator. So addiction counselors, we frequently work with a lot of individuals who are at an increased risk for HIV exposure. They're at an increased risk of medical complications and sudden health emergencies. And this increased risk is not due to moral failure or like a personal weakness. It's tied to factors like substance use patterns, injection drug use, sexual risk behaviors, homelessness or unstable housing, incarceration or criminal justice involvement, maybe a limited access to health care. And at the same time, counselors are often among the first professionals present when someone discloses HIV status, or they experience a medical issue, or they are showing signs of health emergencies during treatment. So that's going to place us in a really unique position because we're not medical providers, but we are responsible for the client's safety. And we don't diagnose, but we do educate and refer and respond appropriately. So this training exists to help us and help you navigate that balance with confidence. So this 3-hour asynchronous course means that it is self-paced. It is designed to fit into your professional schedule. And across this course, we're going to focus on 2 primary content areas: HIV and AIDS awareness and ethics, and the foundational first aid knowledge for behavioral health settings. And this course is divided into really short focus modules that are going to include brief lectures, visual explanations, scenario-based learning, and some knowledge checks and quizzes. I'm not going to ask y'all to perform any clinical medical procedures or diagnose conditions or practice outside of your scope. Instead, the focus here is on knowledge, being prepared, and some ethical decision making and safety. And by the end of this training, you should be able to increase your understanding of HIV/AIDS transmission, prevention, and impact, particularly within substance using populations. We want to strengthen our ethical and professional decision making, especially when it's related to confidentiality and informed consent and stigma. And we also want to demonstrate some foundational first aid awareness that's relevant to behavioral health and community settings. And we want to respond appropriately to medical concerns and emergencies while maintaining those professional boundaries. We also want to make sure that you're meeting certification, licensure, and workplace safety expectations that are related to HIV education and the first aid training. And these objectives, they're intentionally aligned with what are the common expectations from credentialing bodies, employers, and regulatory agencies. So let's just pause here for a second and really define scope of practice, because this is one of the most important concepts in this entire course. So as addiction counselors, what we can do is educate our clients about HIV transmission and prevention. We can discuss risk behaviors in a non-judgmental way. We can encourage testing and treatment. We can provide referrals to medical providers and community resources, and we can respond to medical emergencies using basic first aid principles. And we can also call emergency services when necessary and document any incidences appropriately. What we can't do is diagnose HIV or any medical condition. We're not going to interpret lab results. We're not going to provide medical treatment beyond that basic first aid. And we're not going to give medical advice outside of your training. And we're not replacing emergency medical services. So throughout this course, you're going to hear repeated phrases on, or like an emphasis on the phrase recognize, respond, refer. That phrase kind of summarizes your role perfectly. So both HIV related work and first aid situations bring up strong emotions. It's going to bring up some urgency in our clients and some fear for the clients and the counselors. So what we need to do ethically is protect our clients' confidentiality, first and foremost. And in Georgia, there's even an added protection about HIV status above and beyond the normal confidentiality that we have. We want to avoid stigma or discriminatory language. We want to obtain informed consent when it's appropriate and maintain clear professional boundaries. We always want to act in the client's best interest without exceeding our competence. So this course is going to repeatedly return to ethical decision making, because knowledge without ethics causes harm, even when the intentions are good. So I want to be clear here about what this course provides. So this course is educational, it's preventive, it's safety focused, it's professionally relevant, but it is not a medical certification. It's not a CPR or first aid credential. It's not a substitute for clinical medical training. If you are required by your employer to hold a formal CPR or first aid certification, that has to be completed through an approved provider. This course kind of complements it. It doesn't replace those trainings. So as you are moving forward in this training, I'm going to encourage you to approach the material with curiosity and some humility and professionalism. HIV and medical emergencies, these are topics that carry fear, shame, stigma, but they're also areas where accurate information and a calm response can really save a life. In the next module, we're going to begin with the fundamentals of HIV and AIDS, and that's going to include definitions, histories, current realities, and this will really lay the groundwork for everything that follows. So when you're ready, proceed to Module 2, which is HIV, AIDS, and Fundamentals.